Okay, part 2 of the medication. So let's see now. What do we have? Okay. Those little tablets is basically bismuth salicylate. So basically is like Pepto-Bismol. So those ones are great because, as you can see, and by the way, I love those little bags. You can buy them at different places. Adventure Medical Kit has a little kit like this. It's like for a refill and stuff, and I think that's the one I bought from. But there's different places I buy, and the reason I like them like this is, first of all, the dose are there. The expiration date of your medication are right over here. And as well as you see all the warning for the medication and the dose and their use. So it's great like when you carry them. It's a little bit more expensive, but instead of like buying bottles and doing stuff and everything, you buy a bag and just put that in your stuff, and every 2 or 3 years you buy a new bag, and so it becomes like not that expensive. Those ones though I would recommend, because probably those ones we're going to use more than those. I would buy like a bottle like this and refill it with the regular bottle and just change my dates. But those ones, hopefully you're not using like candies, because then there's maybe an issue there. so one of the reasons to use Pepto-Bismol is it's great for a lot of stuff. Basically everything from the mouth to the rectum, it's basically can be used. So it can be used for indigestion, diarrhea, heartburn, belching, gas, nausea, upset stomach. So basically, if you don't know what you're having, but you don't feel good, you take that. One thing though you have to be aware of is that if you take this, it will turn your poop black. Yep. So we did have like some people sometimes come to the emergency and like, oh my god, my stools are black, I'm bleeding. No, you just took some Pepto-Bismol. So just be aware that their stool will turn black with that stuff. But great thing to use like on multi, if you're not quite sure what's going on with your stomach and things like that. So and then antihistamine, Benadryl and all. So in the antihistamine, there's 2 different kind of categories. There's the Benadryl that you should all have to carry, and actually also while talking to the stuff, comes as well as a cream. So for each relief, so this is the cream, this is the pills. So we're talking more about allergic reaction, rash, and stuff like this, and you can use those. So allergic itch, minor skin irritation, poison ivy, insect bite, mild sunburn, and mild sunburn. You're like, what does it has to do with an allergic itch? So why Benadryl is marked here as a mild sunburn, and that's why I carry as well, because it has multiple use again, is that Benadryl is kind of what we call it, like it's kind of a dirty drug, so it acts on different things. And what creates pain a lot of time on your on the nerve there is like the sensation. So it will activate. So when you have like a sensation to your ending of your nerve, it will send an impulse as what did you just have a sensation, and a lot of time. So what does this do? It kind of acts on the sodium pump of one of those, and it stops it. So it becomes almost like a numbing. So basically, if you're using stuff to and you want to numb the skin to do like a small procedure or something, you could use Benadryl. Obviously, do not use that thing too much. And anything of a good thing, too much of a good thing is a bad thing. And antihistamine, especially, you can overdose on that stuff, and there's pretty nasty stuff that you can do on those things. Don't forget that this and this is the same product. So if you put this on the skin, it will be absorbed by the body. So not because you put it under a cream that it doesn't go into your bloodstream and stuff like this. So for example, if I take this and I take a pill, I just double dose myself. So just if you're using one, don't use the other one, or use less. And so just be careful about that. Is that it does have the same, you see, different edramine and different endramines. They have the same stuff. So if you put a cream or anything, it's just the medication is differently applied, but it can be used to different things, so you can absorb it, as well as anything you put on your screen, including patch and stuff like this. If you're going under the sun, or if you're doing something that are very hot climate, or you're working hard and stuff and sweating a lot, be worried that not be worried, but be aware that, for example, if you put a patch for pain control, or if you have a nitro patch, or even worse, a nicotine patch, like for example, you're trying to stop smoking, and you bring when they did that medication, is for a regular use. So that means, like you're walking around and not doing much. But if you're wearing that patch and you're starting to do exercise and stuff, your skin, because the blood will go circulate quicker and your pores of your skin will open up more, that medication will be sent. There are more medication that's going to be sent to your bloodstream. And actually, you can, even if the patch is safe to use on regular use, it can become a danger if used in this way, in that manner. So just be aware if you're going for, and a lot of time you'll see on the patch it says that do not use in a sauna, things like that. So anywhere that your skin would open the pore or have like more circulation to it because you're trying to liberate some heat, the patch will absorb more. So it goes the same thing for the cream. So be careful when you use those things, that this is the product, so be wary about that. As well as the one I use a lot is Reactin, and the reason I use Reactin versus the Benadryl is so for mild and moderate allergic reaction. And I'll probably do a whole video, especially in the summer, using about the EpiPen and stuff like this, is that it has less drowsiness, because this can cause drowsiness. So it has less drowsiness, and also instead of being short acting, it's long acting, so it can go up to about 24 hours with the Reactin. So it's Bismuth. Okay, so anti-nausea pills. There's a whole bunch of them outside. They work on all different ways of doing it. You can be nauseous for all different reasons. So depending on what you're going to do, you can. So those ones are for motion sickness, and so this is the most. So, for example, if you have the Pepto-Bismol for regular nausea, and this one for motion sickness, so there's a reason why we have something. So, for example, if I eat something that doesn't fit in my stomach. So, for example, I ate like a chicken that had like salmonella or something like this. My body will recognize this and will try to get rid of it. And the way it tries to get rid of it is by there's two ways it can go out, through the entrance and through the exit. And so that's how it's going to do. It's going to make you vomit, and will try to create diarrhea as well. Doesn't mean that all diarrhea are because of this. There's different reasons why you can have diarrhea, but there can be two of those. So sometimes trying to hold off on stuff is not a good thing, because you want it to go out. So it's like, if you're nauseous and you're taking this thing, just ask, before you take any pills, any medication, always ask yourself, why? Why am I nauseous? If you're on a boat and it's like, very windy and stuff, well, it's like, okay, well, it's motion sickness most likely, so I'll take those pills. But always ask yourself the why. Why am I taking those things? Because your body is trying to tell you something. So if you have, for example, a headache and you're high altitude, the body is trying to tell you something. Sometimes you can also be too dehydrated and your body will try to tell you something. So if you stop yourself and try, you ask yourself your why, instead of just I have a headache, go straight to the Tylenol, you're going to maybe find out something about because your body is doing something, because this is a symptoms. So that's what it's a symptom, because you're feeling something and your body is trying to tell you something. So good to carry, but just be wary that, you know, don't take pills just to take pills. There's a reason the pills are made and they're good use, but there's another reason that your body is trying to do something. And so sometimes, if for example, if I take salmonella and I'm trying to decrease my nausea or my vomiting with this, well, maybe the best treatment would be to just get that thing out and just vomit it, and then you feel better. And maybe it'll be just like one vomit versus like feeling crap because all this thing is in your body. And as well now is like, because you suppress it, what happened is that now you're giving a place to grow even more bacteria, and you actually create even more damage. So basically this is it's a good use, but just be wary when you use it. In the same category, but on the other entrance, Antidiarrhea, same thing. And this is the lopramazole hydrochloride, or better known as losing them the word, but anyway, it's for diarrhea. So diarrhea is there's different reasons we can have diarrhea, and most reason is because either we have a bacteria inside us, or again, like we ate like something that didn't fit too good and things like that. So our body is trying to get rid of it. If of course, if you're in a survival situation, you're afraid of being dehydrated. Yeah, okay, sure. Yeah, you may want to try to maybe keep, your water inside and stuff like this. But taking too much, and if you look on the package and the warning and things like that. So, for example, stop use as if diarrhea lasts more than 2 days. You get abdominal swelling or bulging. These may be sign of serious condition. So, let's say, for example, let's say I have a bad bacteria in my stomach, and that's why I have diarrhea. And we'll probably do a video on diarrhea. Yes, yes, I will do a video on diarrhea. But let's say I have this, and I'm taking those pills and holding everything inside. Now what I just created is a place for the bacteria to grow. And then when they're gonna do, now they're all in my stomach, so they're not too worrisome. But if they go and transfer from my guts to my blood, now it's in my blood, and now I can have a serious disease called sepsis. And when you have sepsis, it means that you had an infection generalized into your body. And if you have this, it is downhill from there. We're talking multi-organ failures and everything. If you do not have the right things to do, you do not want to sit. Even in the hospital, when we catch like a sepsis very late, it's hard to turn back. So you do not want to be in the middle of nowhere with sepsis, trust me. Diarrhea again. If you have diarrhea, for example, you're about to do a car ride or something like this, and you don't want to stop, or let's say you're at a camp and you decided, I'm going to get out of here because, like this diarrhea is killing me. Well, and you want to ski the ride back. Yeah, sure, take that, and then it's going to hold you for 4 or 5 hours so that you can get out of there, or something like this. But just because, again, your body is trying to tell you something. So that's it for that. So I wanted to talk about a few of those pills and stuff like this, and hopefully that was helpful. And I'll talk to you on